So, hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. In today's YouTube live session, we'll study about amputations. Amputation short topics. कभी कभार question आता है in surgery or orthopedics. Okay, and so जल्दी से we'll cover it. Short topic है and जल्दी से we'll cover and know all about it. I am currently working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the same NEET PG examination last year, that is in 2020 only. So basically, I am here to share my experiences and also because I can correlate with you yes, what are the problems every student who prepares for the PG examination faces. Okay, so here we'll study orthopedics in depth so that you can not only crack your NEET PG INI-CET like professional examinations, but also your prof or university examinations, and we'll have special focus and emphasis on clinical based scenarios, the x-rays, the clinical based questions, okay, and the images, keeping in mind your coming next pattern as well as your practical examinations as well as your aajkal ke NEET PG K questions types. Okay, so let's start today's lecture, and before starting today's lecture I would just briefly guide you about various subscription plans that are available for NEET PG on Unacademy. The first one is your Plus subscription plan. The Plus subscribers will get access to all our live as well as recorded classes. They can compete in live tests and quizzes, and also they can access the entire QBank, all of which is formed by the India's topmost educators for the NEET PG. Also, will allow these subscribers to log in to the to different devices by the same account so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we are shortly providing them with a printed notes. Okay, so you can use this code while subscribing to get extra 10% off. And the second one and the best one is your iconic subscription. It is best not only on Unacademy but across any digital platform across India, and it is best because apart from the things that I have told you earlier, uske alawa you get the prep ladder and all of the prep ladder, including all its Q banks, the video lectures, the rapid revision courses, grand tests, quizzes, everything of the prep ladder. And on Unacademy Extra May, you will get access to a well structured live batch wise classes, and we have formulated these batches and structured a course in such a way so as to build your basic concept about every topic or the subject first, and we'll try to cover your basic subjects like the subjects of your first year, second year first, then going into the clinical based questions or the in-depth of the topic. Okay, and we also try to clinically correlate like amputation टॉपिक है, ये आप सर्जरी में भी पढ़ोगे, ऑर्थोपेडिक्स में भी पढ़ोगे. सो एट बोथ द टाइम्स वील ट्राई टू कवर इट and we'll try to revise what you have studied in that other subject. So ज़्यादा कुछ चेंज नहीं होगा, ऑलमोस्ट एवरीथिंग वुड बी द सेम, बट येस वील रिवाइज दैट थिंग सो दैट यू विल बेटर अंडरस्टैंड दैट एंड यू विल बेटर remember that. And also on Unacademy, the iconic subscribers will get an individual test analysis sheet after every test that they give so that they can analyze themselves yes, this topic or this subject needs more improvement, or kis type ke questions are more common in this type of subjects. Okay, and best way to revise also, so you get to know the very important things and you get to know yes, are you on the right path. So it's very important to sincerely analyze your tests. So these all will be available for the iconic subscribers. So while subscribing, you can use my code AnshulB10 to get extra 10% off. And very important are these special classes. I tell you every time that special classes will give you extra edge over your competitors. Okay, and also they are special because in this COVID time also you will have a live classroom like feeling where you can interact with your educators. You can just clear your doubts there and there, only participate in polls, etc. You can watch it anywhere anytime by just logging to your mobile application. So iske liye you just need to download the Unacademy app, which is absolutely free, and you need to use this code for subscribing, which is also absolutely free. Okay, and we'll also be providing you with the digital lecture notes of every special class that you attend. Now, keeping in mind the different sets of students who are preparing for different examinations, like some are preparing for INICET or FMG or the 2022 examination or the next examination. So we have started dedicated batches to these following courses, and you can subscribe using this code for these courses, and if you will use this code you will get extra 10% discount. And we have started FMG and the 2022 batch from the 8th September, and from the 15th September we have started a INICET examination, and very importantly INICET examination dates have been announced and it is 14 November. So buckle up, less than 2 months of the are left. So jiska bhi the target is INICET for this year, you need to buckle up your studies, you need to get in the groove and start studies again. Okay, and we have started a very important batch, that is clinical examination and procedures batch from 15th of the September, and it is must attend batch and very important for every student, be it for your professional or your university examinations, because practical may help karte hain better understanding of the subject or the things that you have read theoretically, क्योंकि theoretically पढ़ना and उसको देखना are two different things, and once you see that cheese or correlate that thing, you will never forget that thing. And also very importantly, these build up your interest towards the subject and your studies, and this is very important. Yes, interest is very important, so please do attend this these classes, and you can just subscribe for this courses, and you can use this code, that is Anshul B10, while subscribing to get extra 10% off. Okay, now we are running two limited time period offer. In the first one, if any subscriber will subscribe for 12 months or more, they will get 2 months of that extra mein absolutely free, and 24 months or 2 years pe you will get 4 month extra mein absolutely free. And the second one is we are giving a heavy discount on our iconic subscription. Okay, earlier for the 4 years the subscription used to be for 75,000, now it is for just 65,250 for the entire 4 years. And if you use this code you will get extra 10% off also. So it is a very limited time period offer. Go quickly and grab this offer, it is a very decent offer. Now this is a price list for the plus subscription, and here you can see the per month cost of the package decreases significantly if you increase the number of months of your subscription. So please do this, and also it is very important for your academic point of view, because starting say you need to have a trusted source of single source of information that is trusted, and Unacademy is the best, because if you study the same topics from different sources, you will waste your time, it will be very cumbersome for you to revise. Okay, so it will be very hodgepodge kind of situation, it will be very frustrating for you also sometimes. So have a single source of information and revise that only. Okay, so go for subscription packages with longer duration. Okay, now let's start today's lecture about amputation. Okay, so what is amputation? Amputation is nothing but a procedure where a part of the limb is cut, okay, and separated from the body. And what is disarticulation? Disarticulation yani joint. So joint को अलग कर देना. Like elbow joint है, so elbow joint if you'll disarticulate it, you'll disarticulate the distal and the proximal part, so the radius and ulna will be removed completely, or humerus will be intact completely. So you disarticulate and the distal part is discarded. So this is called as disarticulation. Most commonly amputation जो होता है, it involves the lower limb. Okay, it is done in the lower limb, and most common cause of amputation is your injury or trauma. Okay, most common cause of amputation is your injury or trauma. Okay, upper limb amputation, thresher injury in especially at the time when the in December, January. Okay, in this time during putty chopper or in the farmers, the thresher machines, etc. इसमें the upper limb amputations are common, and lower limb में train accidents में the lower limb amputation is common. So in amputation के indications and causes age group के हिसाब से different होते हैं. Like in elderly, it is generally due to some associated systemic disease like diabetes with peripheral vascular diseases, etc. In younger adults, it is due to trauma or the injury, and in children, it can be present since birth also. And in acquired cases, most common cause of amputation in children is malignancy. Okay, most common cause is your malignancy. So different age groups में different cause होता है, but overall injury is the most common cause. Okay. Now types of amputation, basically दो types of amputation होता है, open and close. First is the open amputation, that is also called as guillotine amputation. Okay, guillotine amputation or the open amputation, and नाम से पता चल रहा है, here you will not do the closure of the skin, यानी primary closure. It is called the primary closure if this closure is done at the time of surgery. So primary closure is not done, the amputated limb is open. Okay, left open as such, this is called as open amputation, and it is generally done in infective cases, like if there is run over by train and there is traumatic amputation, so you leave the amputation stump open because there are chances of infection, etc. So generally in infective cases or the traumatic cases, you leave the amputation stump open, or if you have any doubt of ischemia, etc., you leave the amputation closure, the amputation open. Okay, so अब amputation open होने के बाद you do the dressing and you check कि if everything is normal, proper granulation tissue is there, then you go for the closure. And closure, the most commonly done closure is the secondary closure, where skin flaps को you close over a few days, or plastic repair if the wound is not healed properly or the closure is not possible just by approxing the skin flaps, then you need to repair the soft tissues, plastic repair. Or if the amputation is not done properly, like there is exposed bone or there is very intense infection there, pus draining out, okay, especially in road traffic accidents, etc. So you need to revise the amputation, and in this also you cut a small part of the bone and the stump is reconstructed. And reamputation, if पहला वाला amputation ढंग से नहीं हुआ है and बहुत और ऊपर proximal level पे you do the amputation like a new amputation, then it is called as reamputation. Okay, see, this is your open amputation here, it is left open, but this is wrong. Bone is never left open. In open amputation also, bone is never left open. Bone is covered with the muscles. Muscles are tied together by the sutures and bone is covered. Okay, so always remember कि open amputation में भी bone is not exposed and muscle भी skin को आप like this, ऐसे close नहीं करते, you keep it apart and you just put the tag suture. Okay, so open amputation में bone expose नहीं होगी, but skin closure नहीं होता है. This is your closed amputation. Okay, now closed amputation most common in the elective amputations. Okay, and हमेशा चाहे क्लोज्ड छोड़ो या ओपन छोड़ो, यू पुट द टॉर्निकेट, है ना, यू पुट द टॉर्निकेट, यू नोट द टॉर्निकेट टाइम, बिकॉज टॉर्निकेट आप एक लिमिटेड टाइम पीरियड से ज़्यादा नहीं लगा सकते, अदरवाइज देयर विल बी पाल्सी ड्यू टू nerve compression, and also there can be chances of repeat amputation, because due to loss of blood supply the muscles can get necrosis and the part of the limb can get gangrenous. Okay, so it is a very serious thing, and it is a part of negligence. Agar tourniquet, if you don't remove the tourniquet or you put the tourniquet for a longer time, so tourniquet use करना चाहिए, but very rationally. You put the tourniquet, you note the time, you do the amputation, because tourniquet is important. Otherwise vessels जैसे ही आप कट करोगे, before ligating there will be a massive blood loss, and also you will not be able to identify the vessels, because इतना blood loss होगा कि proper view नहीं आ पाएगा, you will not be able to identify. So tourniquet is important. Okay, what is exsanguination? Exsanguination is you the literal definition is इतना सारा blood loss हो जाए कि there is death of the patient. Okay, so flow of the blood. So generally in elective procedures what you do, you take a tourniquet called as S-mark bandage. Okay, called as S-mark bandage, and you squeeze the part which you are removing. Okay, in the proximal direction, that is called as S-sanguination in amputation, and it is done with the help of S-mark bandage. Okay, this is your S-mark bandage, and tourniquet भी इसी से ही लगाया जाता है. ठीक है, तो S-mark bandage, and you put it and then you squeeze it. This is exsanguination, and it is contraindicated in infection as well as in malignancy, because वो proximally infection और the cancer cells के spread का there is risk. Now level of amputations, earlier it was very strict कि इतना ही level होना चाहिए, but with new prosthesis and newer technology ये इतना important नहीं रहा है. But फिर भी you need to remember कि below knee amputation में at least 10 centimeters of the tibia should be there. Okay, at least 10 centimeters of the tibia should be there, and अपन बोलते हैं कि the best is ankle joint से 10 centimeter above is the best. Okay, so principles, first of all disease, कि कहाँ से amputation करना है, it depends on the disease कि इन्फेक्शन कहाँ पर है, malignancy या ट्यूमर कहाँ पे है. सो कंजर्वेटिव अप्रोच एंड लिबरल अप्रोच. तो कंजर्वेटिव अप्रोच यानी कम से कम एम्पुटेशन करना, यू डू इट फॉर द गैंग्रीनस और द ट्रॉमेटाइज्ड और द इन्फेक्शियस पेशेंट्स. बट लिबरल यानी यू आर लिबरल की यस अगर 5 सेंटीमीटर में ही लीजन है बट स्टिल भी ओके 7-8 तक भी कर दो, मतलब ज़्यादा normal area is also amputated. That is called as the liberal approach, and it is done in treating of malignancies and infections. Okay, okay, ट्रॉमा के बाद अगर उसी में ही वापस इन्फेक्शन हो जाए, then you have to follow liberal approach. Remember malignancy in this. Malignancy is important. So while doing amputation, you preserve certain structures. Okay, yeah, you tie certain structures, but there is a sequelae कि yes पहले ये then ये then ये. तो सबसे पहले amputation में you preserve the bone. Okay, you preserve the bone, then your extensor muscles को repair करते हो, the extensor mechanism को repair, then your flexor mechanism or the flexor muscles, then your artery, then your nerve, and then your vein, and इसी सीक्वेंस में यू कट. बट ये फ्लेक्सर्स और एक्सटेंसर्स तो पहले ही कट हो जाते हैं, तो सबसे पहले आप बोन को कट करते हो, देन यू identify the nerve bundle and you ligate the artery. Okay, then you cut the nerve, and generally vein जो होता है वो artery के साथ ही आ जाता है. Okay, तो beef and bone, extensor, flexor, artery, nerve. Okay, नाउ स्किन फ्लैप्स जो होते हैं, जो स्किन के ऊपर जो स्टम्प होता है उसमें तो स्किन फ्लैप ऐसा होना चाहिए, टाइट नहीं होना चाहिए, इट शुड बी मोबाइल एंड नॉर्मल स्किन लेते हैं जो कि सेंसिटिव हो. ओके, एंड इफ बोन इज कट फ्रॉम दिस एट दिस लेवल ना, मसल्स एटलीस्ट उससे ज्यादा डिस्टल की काटते हैं, बिकॉज यू नीड टू कवर द बोन ऑल्सो. ओके, वेरी इंपॉर्टेंट. अब सूचर्स जो होते हैं, ये मसल सूचर्स, ओके, नॉट स्किन, मसल सूचर्स, दे आर टू टाइप्स, माइलोप्लास्टी और माइलोडेसिस. अगर ऑपोजिट ग्रुप ऑफ मसल्स को यू सूचर टू ईच अदर, ओके, like the flexors and the extensors, or at the opposite side, then this is called as myeloplasty. It is done most commonly. And second is myelodesis, where sari muscles ko you suture with the amputation stump, okay, or the end of the stump. This is called as myelodesis, and it is contraindicated. Myelodesis is contraindicated in PVDs, peripheral vascular diseases. ओके, एंड नर्व्स को हमेशा आप कैसे कट करते हो? नर्व्स को यू आइडेंटिफाई द नर्व्स, देन यू पुल द नर्व्स. ओके, खींचते हो, पुल द नर्व्स, एंड यू कट द नर्व्स एज प्रॉक्सिमल एंड पॉसिबल आफ्टर पुलिंग, बिकॉज because to avoid that phantom limb wala condition that we will discuss. Otherwise there will be very intense pain. And also is first reason to prevent phantom limb, and second reason is to prevent neuroma formation. Okay, and these neuroma formations are also painful. अगर आपने वहीं ज़्यादा खींच के नहीं काटा है तो the ends of the nerves will form a swelling called as the neuroma, and they can be at the amputation stump also, and they will be very very painful. Okay, so major blood vessels, you identify them and you ligate them at least at two sides with at least two sides पे ligate करते हैं, and every side पे you ligate it at least 2 times. Okay, by non-absorbable generally use proline sutures. Okay, it is in the books, but in our facility we use vicryl also. Okay, so this is, and also ये याद रखना, periosteum you need to remove because you cut the bones. Bone cutting के लिए you don't have a saw or type of things, you have a wire that is called as jiggly saw wire. Okay, you have a wire that is called as the jiggly saw wire for the cutting of the bone. Okay, and ये ध्यान रखना, proximally ज्यादा पेरियोस्टियल स्ट्रिपिंग नहीं करनी पड़ती, क्योंकि जब आप जिगली सॉ वायर से यू कट दैट, देन देयर शुड बी नो पेरियोस्टियम एट दैट साइड, अदरवाइज it will be problematic to cut the bone. Okay, so you remove the periosteum, but ज्यादा posteriorly you should not remove the periosteum because उसमें blood supply होती है, and if there is infection, अगर वो infection proximally it goes, then there will be osteomyelitis and it will lead to the formation of ring sequestrum. Okay, अगर आपने periosteum बहुत proximal तक remove कर दी है, then it can lead to the formation of ring sequestrum at the stump side. Okay, very important. And this is your ring sequestrum. And generally in traumatic cases or infective cases, what you do, you fix this type of tube which is called as the CRD drain or the corrugated rubber drain. corrugated rubber drain, and if there is any soakage or the infective material, वो यहाँ से at the end it spills off. Okay, so वो अंदर इकट्ठा नहीं होता है and और infection नहीं करता है. It is a drainage system called as the CRD drain or the corrugated rubber drain. Okay, now after treatment amputation का rehabilitation is very important. Proper prosthesis, and physiotherapy, etc., and also the counseling sessions, because it is very disturbing if you lose a limb. Okay, and phantom limb and etc. There are very other conditions. So yes, proper counseling, proper physiotherapy and proper prosthesis all are very important. And so इन सब चीजों के लिए you need to have a good amputation stump. तो उसके लिए dressing is very important. First is the conventional dressing जो soft tissue में होती है. Second is the rigid dressing, and this is better dressing and preferred dressing. ओके, तो इस रिजिड ड्रेसिंग में क्या होता है, सॉफ्ट टिश्यू की ड्रेसिंग करने के बाद जस्ट यू पुट अ पीओपी स्लैब देयर. ओके, लाइक दिस, जस्ट यू पुट अ पीओपी स्लैब so that it is rigid and there are less chances of infection, etc. So it is very important कि rigid dressing is more common. These are the levels of amputation. So what is the difference between shoulder disarticulation and four-quarter amputation? In shoulder disarticulation, humerus is removed completely, but in four-quarter साथ में you remove the shoulder blade, that is your scapula also. Okay, scapula को भी remove करते हैं in your four-quarter amputation with clavicle. ओके, एंड इन दोनों में से भी स्कैपुला इज वेरी इंपॉर्टेंट, जबकि इन शोल्डर डिसआर्टिकुलेशन clavicle and scapula are there intact. Now above elbow amputation is called as transhumeral and below elbow is called as transradial. This is disarticulation. Okay, hip disarticulation and hemipelvectomy same होगी, ठीक है. And because in hip only the femur head will be removed, in hemipelvectomy क्या होगी, you will remove the same side of the ischium, ilium and the pubis bone, the pubic symphysis, sacroiliac joint, pura. This is hemipelvectomy. So above knee is called as transfemoral, below knee is called as transtibial. Okay, now knee disarticulation, अगर knee joint को remove कर दो यानी टिबिया फिबुला को पूरा रिमूव कर दो, तो इट इज कॉल्ड एज, दो टाइप से होती है, रोटेशन प्लास्टी, वैन नीज रोटेशन, ये सब आपके काम करनी है. एंकल में या फुट पे इंपॉर्टेंट होता है एम्पुटेशन. तो सबसे पहले अपन ने पढ़ा था लिस फ्रैंक्सी. दीज आर योर phalanges, these are your metatarsal के हेड, this is your base of the metatarsal, these are your tarsals, this is your ankle joint, this is your tibia, this is your fibula. Okay, so लिस फ्रैंक इंजरी अपन ने पढ़ा था, दैट इज सेकंड मेटाटार्सल के सेकंड phalanx. Okay, second phalanx, the second metatarsal base and the medial cuneiform के बीच में there is ligament, Lisfranc ligament, and वहाँ पे if there is injury then there is dislocation of this ligament. Okay, so जो gap होता है वो बढ़ जाता है first metatarsal and second metatarsal के head के बीच में. So इसी लेवल पे जो amputation होता है at the level of metatarsal base, it is called as the Lisfranc amputation, and at the level of tarsals it is called as Chopart amputation, and just above the ankle is called as the Sims amputation. Okay, so Lisfranc amputation, Chopart amputation at the level of tarsal. देखो, this is your calcaneocuboid joint, this is your talonavicular joint, तो इस joint से. And what is Sims amputation? Sims amputation is knee, मतलब नी डिसआर्टिकुलेशन से पहले इसे ऊपर होता है, यानी यू रिमूव द लास्ट जस्ट 0.5 to 2 centimeter part of the distal both leg bones. Okay, this is your Sims amputation. Now complications, if there is not proper drainage, then there will be hematoma formation, and it will be a source of infection and site of infection. It can be due to poor ligature or opening or loosening of the ligature or inadequate wound draining. So इससे wound healing and infection delay हो जाती है. So hematoma and secondary infection can be there, and generally if there is diabetes or hematoma or other conditions associated, and जब भी there are chances of infection or there is a doubt on the vascularity, you should leave the stump open. Okay, skin flap necrosis can be there if skin is not closed properly and if the flap is very tight. Okay, in such cases skin flap necrosis can occur, and deformities of the joint due to the improper position of the amputation stump, and also due to poor rehabilitation or poor physiotherapy. Okay, now here is the amputation. This is called as the amputation skin incision. Okay, amputation में skin incision ऐसे देते हैं, and remember the posterior part is larger. Okay, हमेशा ये ध्यान रखना है, जो posterior flap और the incision होता है, it is larger and the longer, and this type of incision is called as the very important fish mouth incision. Okay, see, it is just like a fish mouth, so it is called as fish mouth incision. So अगर मान लो I have to do the incision, the amputation of this part. This is my this is my anterior part, this is my posterior part. So I will put an incision like this here. It will be longer as compared to the incision on the anterior side. Okay, ऐसा क्यों? क्योंकि obviously पोस्टीरियर का बड़ा होगा, तभी यू विल गेट द फ्लैप लाइक दिस. कभी भी फ्लैप ऐसे नहीं आता, फ्लैप इज लाइक दिस. सो पोस्टीरियरली लाइक दिस द फ्लैप विल कम. न्यूरोमा वी हैव डिस्कस कि अगर आप पुल करके, इफ यू डोंट कट द नर्व आफ्टर द पुलिंग, देन एट द एंड देयर विल बी अ स्कार एंड फॉर्मेशन ऑफ न्यूरोमा व्हिच इज पेनफुल. ओके, सो इसके ट्रीटमेंट में क्या होता है, you identify that and you cut that more proximally. Now phantom sensation, very important. What is phantom limb? Phantom limb is nothing but the sensation of the amputated part. Okay, like if I have disarticulated the knee in any patient, then the patient will still feel like he or she have the entire leg or the ankle. So this is called as phantom limb, and it is a normal physiological process that occur in every individual going through amputation. Okay, and इसमें ध्यान रखना, painful as well as non-painful, both type of sensations can be there, very importantly, and they are most often painful. Okay, and most commonly they are common, and सब हर केस में होते हैं immediately just after the amputation. Okay, and gradually they subside in the intensity. So immediately following the amputation they are the most prominent, and this is also called as the ghost limb. This is also called as the ghost limb. Okay, here you can see what is this. This is end neuroma at the amputation stump. Okay, here you can see just after the amputation, this is called as gradual telescoping of the phantom limb. Okay, phantom limb में gradual telescopy होती है कि first of all you will feel कि yes, I have entire leg till the foot, then और कम हो जाएगा, and then just that it is your foot part. Okay, like this. This is your ghost limb or telescopy in the phantom limb. Okay, and remember कि जो आपका amputation वाला part है, if at the level of amputation you will have the also pain, but that is due to surgery, and that is intense pain. Okay, see like this, that is intense pain or shooting pain बट इसके नीचे जो फैंटम लिम की वजह से जो पेन होगा दैट इज मोर ऑफ अ बर्निंग टाइप ऑफ पेन, एंड जनरली एट डिफरेंट लेवल्स इन द लोअर लिम इट इज डिफरेंट, कि in the ankle or the foot you will have the burning, distal one third or lower tibia mein you will have the stabbing kind of pain, around the knee you will have the shooting kind of pain, and in the thigh you will have the cramping type of pain. So different types of pain होते हैं in phantom limb. And very very important कि phantom limb किस पे based होता है, phantom limb is based on the law of projection. So law of projection क्या बोलता है कि like if I have a receptor here and this receptor gets its signals from the entire this region, then okay, entire this region. So if there is any injury to this at the site of receptor, or any injury between at any level between this and the brain, then सिर्फ इस एरिया का नहीं, इस पूरे एरिया का there will be loss of sensation. Okay, so this is called as the phantom limb. या फिर यहाँ पे is if there is some stimuli here, then or there is some stimuli anywhere in its path, then the entire area which takes the sensations of that receptor will be affected. So अगर आपने amputation यहाँ से कर दिया है, मान लो if you have done the amputation from this side, okay, and the receptors proximal to the amputation site have sensations from all these areas. Okay, so you will have sensations of these areas by the law of projection. Okay, so very important in phantom limb. Okay, so phantom limb सब में होता है physiologically, so you give the NSAIDs etc. But if it is affecting the psychiatric condition of the patient, I have seen patient one or two in my ward also, but it is seriously very difficult mentally for the patient to go through the amputation and the feeling of that phantom limb. So you need to have a psychiatry evaluation sometimes also, but with time it is less intense, and also the patient begins to accept. No, now special features of amputation in children. So बच्चों में you generally try to preserve as much as possible, and you try to disarticulate more. Okay, amputation can be since birth also in children, and disarticulation is preferred because if you disarticulate then the एक epiphysis जो होता है that is your distal, that is preserved, and if epiphysis is preserved then the bone growth जो होती है it is well mannered and it is at a normal rate. But अगर ऐसा नहीं होगा तो there will be abnormal growth. And remember very importantly, in children amputation, revised amputations are a frequent thing. Okay, children frequently needs to change the size of the artificial limb or prosthesis also, and need frequent revision. ओके, एंड ये ध्यान रखना है प्रोस्थेसिस या आर्टिफिशियल लिम्स भी चिल्ड्रन के अंदर ज्यादा अच्छे से वर्क करते हैं, एंड चिल्ड्रन टॉलरेट देम बेटर आल्सो. रिमेंबर दिस थिंग. Okay, so what is prosthesis? Prosthesis is nothing but if you replace any body part, like in amputation, if you replace a prosthetic leg, it is external, and internally like in hemiarthroplasty, bipolar, or the total hip replacement, total knee replacement, etc. Okay, and with time obviously these have improved. And Jaipur foot sabne hi suna hoga. So Jaipur foot, the below knee amputation के लिए there is a prosthesis developed at Jaipur in our hospital, SMS hospital only. So it is very important, and also it is very famous across the world. So Jaipur foot याद रखना, इस पे क्वेश्चन भी आता है. Okay, now upper limb में prosthesis is more difficult, ये याद रखना है. प्रोस्थेटिक्स की नीड दो की वजह से होती है. फर्स्ट इज कॉस्मेटिक, नॉर्मल अपीयरेंस. सेकंड इज फंक्शनल, एंड फंक्शनल इज मोर इम्पोर्टेंट. ये ध्यान रखना है कि प्रोस्थेसिस डज नॉट हैव सेंसेशंस, they will not have the pressure sensations or the proprioception, and also there will not be any muscle power. तो power कहाँ से मिलती है? Power is attained from the remaining part of the limb. Okay, so that provides the residual power, or and this is called as, such type of prosthesis is called as the body powered prosthesis. But nowadays battery powered prosthesis भी मार्केट में आ चुके हैं. एंड इन जनरल जितना ज़्यादा डिस्टल होगा एम्पुटेशन उतना ही ज़्यादा अच्छा होता है, बिकॉज मोर ग्रिप एंड मोर पावर आती है द प्रोस्थेसिस में. ओके, सो इसलिए वी से कि ट्राई टू एम्प्यूट द लिम्ब एज लिटिल एज possible. Okay, so poor prognosis for prosthetic fitting is if there is any lower limb ischemia, okay, or the above knee amputation है but there is some flexion deformity or flexion contracture at the hip, or below elbow amputation है but the shoulder or the elbow joints are not in good functionality, there is osteoarthritis etc, and bilateral above knee, especially with the short stump, they are also poor candidates. So prosthesis above knee amputation में you use the quadrilateral socket prosthesis. What you use the quadrilateral socket prosthesis. In below knee you need the PTB, patellar tendon bearing prosthesis. साइंस एम्पुटेशन में कैनेडियन साइंस प्रोस्थेसिस, एंड पार्शियल फुट एम्पुटेशन में द शू फिलर्स. ओके, एंड हर एम्पुटेशन के हर एम्पुटेशन प्रोस्थेसिस के देयर इज 3 पार्ट. फर्स्ट इज योर सॉकेट जिसमें स्टंप जाता है एंड इट इज द मोस्ट इम्पॉर्टेंट पार्ट. Second is your prosthesis in proper, which have all the distal joints that you have amputated. Okay, and then you have this terminal device. So this is your above elbow prosthesis, this is your PTB prosthesis below knee. Okay, this is your socket, and here it is your suspension giving support to the distal thigh so that there is proper movement of the knee joint. So this is your PTB prosthesis for below knee amputation. Okay. Now orthosis क्या होता है? और it is nothing but a type of prosthesis only, but it is a unit of rehabilitation जो body functions को improve करती है. Prosthesis और orthotics के अंदर क्या difference है? In prosthesis you remove one part of the body and you put an artificial part, like amputation में PTB brace, PTB उसके अंदर prosthesis के अंदर entire new leg is formed, or in the hip joint. Okay, so you remove one part, then you put another part, that is your prosthesis. In orthotics no part is removed, but only you support the already present part. This is called as orthotics. Okay, so they are generally known by the name of braces or calipers, splints or corsets, but now a more logical easy way आ गया है to classify these. And is, for example, previously जो below knee caliper होता था for the below knee amputation, it was known as the sorry, not for amputation, for any pathology below knee it was called as the below knee caliper, but now it is called as AFO caliper. So A for sequential manner में जो joints affected है या जो joints involved है. सबसे पहले ankle, then foot, and last में every orthotic will have the O, which represents the orthosis. Okay, like for the above knee इसमें knee भी add हो जाएगा knee joint पे, तो knee AFO KAFO orthosis. Okay, like above knee with pelvic band was previously called if there is some problem in your hip region also, so it is now called as a hip ankle HKAFO. ठीक है. What is CTLSO? It is important. It is सर्वाइको लंबर सेक्रल ऑर्थोसिस, पहले इसको बोलते थे बॉडी ब्रेस। ओके, WHO इज रिस्ट एंड हैंड यूज्ड, पहले इसको क्या बोला जाता है, कॉकअप स्प्लिंट। ओके, सो कॉकअप स्प्लिंट की जगह नाउ यू call it WHO wrist hand orthosis. Cervical collar, now it is called as CO orthosis, CO। okay, so remember this, इस पे question आ सकता है and it is very easy। okay, now there are two types of orthosis, first is static, second is dynamic। नाम से पता चल रहा है static will support the joint, prevent any paralysis or contractures due to the paralysis, or correction of any contracture if there is any। okay, and dynamic में क्या हो जाता है, dynamic में you also provide the movement। okay, you apply force to the joint, this is called as dynamic orthosis। okay, now uses we have already discussed, and these are different types of orthosis, and I have planned a special class of orthosis, this one I'll tell you about orthosis with their photos। okay, so that will be a special class, that's why I tell you ki every time special classes are very important। okay, so this is your collar brace or soft collar brace, now it is called as CO, that is cervical orthosis। okay, this is 4-post collar used for cervical spine injury, just remember the image। this is your ankle foot AFO orthosis। okay, ankle foot orthosis, this is reciprocal gait orthosis, RGO orthosis, in case of bilateral above knee amputation। okay, now there some questions we will discuss some questions now। most important technical consideration at the time of doing below knee amputation is, okay, here are your 10 seconds, I'm giving you 10 seconds, if anybody knows the answer they can type in the live chat box and we'll discuss them। okay, so the answer is A, we have already discussed that posterior flap should be longer for the closure। okay, so the answer is B, fish mouth incision hota hai। okay, now next question is, a client who had an elective below knee amputation reports pain in the part of his leg that was amputated. What should be the nurse's best response to his pain? Here are your 10 seconds। Okay, so basically all are correct। okay, basically all are correct, but except this, ये लास्ट में जनरली आप पेशेंट से तंग होकर उसको भगाने के लिए बोलते हो, बट ऑल आर करेक्ट, बट द मेन आंसर विल बी ए एंड बी की जनरली फैंटम लिम्ब जो होता है, फैंटम लिम्ब जनरली इट इज नॉर्मल फिजियोलॉजी एंड इट अकर्स इन एवरी इंडिविजुअल, बट किसी में ज्यादा होता है एंड किसी में कम होता है, एंड just after the amputation it is most prominent, and with time it will decrease in the intensity। so mental support is very important, you need to say ki yes there is nothing anything major, don't worry, it will go in a few days, and har jane mein there is a uh, phantom limb wala pain but in different intensities। okay, so this is the best thing how you should treat the phantom limb with NSAIDs and proper psychiatric reference। okay, now what should you encourage the patient with amputation to perform? And the answer will be this, the express feelings about the lost limb, because as I've told you ki mental well-being of a patient after amputation is very important. Next, what are the major complications of having an amputation performed? Okay, very easy. आंसर विल बी ऑल, एंड इसमें से अगर आपको चूज करना पड़े मोस्ट कॉमन कॉम्प्लिकेशन ऑफ एन एम्पुटेशन, यू विल गो विद द फैंटम लिम्ब. You will go with the phantom limb. Most common complication will be your phantom limb. Okay, now next is a true and false kind of question. Wrapping with elastic bandages can also be effective in reducing edema, shrinking the limb, and holding the wound dressing in place. For wrapping to be effective, reapply the bandages every 4 to 6 hours or more often if they become loose. ओके, एंड इसमें आप पढ़ोगे ना, इसमें आपको कुछ गलत लगेगा भी नहीं. सो यस, दिस इज ट्रू. ओके, सो इसलिए ऐसे क्वेश्चन आए बिल्कुल स्ट्रेट फॉरवर्ड आते हैं बहुत बार, एंड इट इज सुपर इजी, है ना. बट वहां पे ड्यूरिंग एग्जामिनेशन आप या यू थिंक, यू ओवर थिंक एंड ज्यादा दिमाग लगा देते हो. ओके, तो इसलिए आई ऑलवेज टेल कि ज्यादा दिमाग नहीं लगाना है, बट क्वेश्चन केयरफुली पढ़ना है. लेकिन उसके बाद you don't need to overthink every word. Okay, so it is true. So this was about the amputation. Jaldi se we have covered, and we had 100% cycled. All the questions of orthopedics were covered in a lecture on YouTube or special class, the rapid revision, the questions. Okay, as it is questions bhi aaye the jo अपन ने discuss करे थे. So 100% strike rate for orthopedics in NEET PG 2024. So that's why I tell you that you can trust us, you can trust Unacademy for your NEET PG preparations. Okay, so tomorrow on Wednesday I'll be having special class on metabolic bone disease, and due to some immediate hospital duties I had to change the timing, so I have scheduled two classes or special class tomorrow. First class is on osteoporosis at 3:30 p.m. and second class is on metabolic bone disease, and I've changed its timings. It will be around at 6 p.m. Okay, at 6 p.m. we will have class on the metabolic bone disease, and at 3:30 p.m. we will have class on the osteoporosis. Okay, so you just need to download the mobile application and use this code to log in, and both of which are absolutely free. Okay, so see you tomorrow. I hope you liked today's class. If you liked the lecture, please like, share and subscribe. And while subscribing on Unacademy for any of our courses, be it NEET, UG or the UPSC, the board examinations, the IIT, etc., anything, you can use this code to get extra 10% off, because Unacademy sab padhata hai. Okay, and very importantly, INICT dates have been announced, and it is November 14. So buckle up, and those who are not confident about the result, they can, yes, 2 to 3 days max to max, you can wait to start your preparation on a serious note. But yes, still you should just give 1 to 2 hours daily, so that you do not lose the touch with your subjects. Just 1 to 2 hours of a question practice, or the images, or anything jaldi se super rapid revision kind of thing you should do. You should remain in touch, and 2 to 3 days mein you should in a full flash manner start studying for the INICT, that is on November 14. Okay, so see you tomorrow. I